Hello, my name is Nurul Fatini binti Roslan, and today I would like to introduce my team member. This is Muhammad Zaid bin Sanang. This is Batrisha binti Zulkifli. This is Nur Fatiha binti Ishmuddin. And this is Muhammad Saifuddin bin Jaimin. The title for our research is How Malaysia Handle Mental Health Issues During the Pandemic of COVID-19. Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus strain. It is a type of virus known to be causing human respiratory infections. The new strain was unknown until December 2019 when an outbreak of unidentified cause pneumonia occurred in Wuhan, China. The epidemic of the COVID-19 pandemic was confirmed to spread from China to other countries, including Malaysia, Singapore, Vietnam, Thailand, Taiwan, Japan, Nepal, Cambodia, Sri Lanka, UAE, US, Philippines, India, Australia, Canada, Finland, France, and Germany in early 2020. Extensive steps to mitigate person-to-person transmissions of COVID-19 are needed to contain the ongoing epidemic. Movement Control Order (MCO) was implemented in Malaysia to prevent the increment of infected cases and deaths. It is one of the methods to flatten the curve, which forces people to stay indoors except to carry out essential services such as go out to buy food or seek medical care. The implementation of MCO, given the impact on the medical field, including gave rise to the percentage of mental health issues in Malaysia. Mental health includes emotional, psychological, and social well-being. During the MCO, there are some cases that involve mental health issues such as stress, anxiety, depression, and burnout. Our survey was conducted online using Google Forms. There are few types of questions that were asked, such as demographic question, closed question, and open question. All of the questions that were asked to prove either the hypothesis can be approved or not.
Based on the analysis of this survey, we know that the percentage of female respondents are 77.1%, that is exactly 84 respondents, and 22.9% of male respondents, that is 25 respondents from the total of 109 respondents. The majority of respondents are from a group age of 18 until 25 years old, that is 76%. 6% from two groups, that is group of 26 until 30 and 41 until 50 years old, and only 3% from age of over 50 years old. Most of the respondents have a level of education of bachelor's degree, and the percentage is 50.5%. SPEM level with a percentage of 9.2%. Diploma level, that is the second highest, with 34.9%, and the others is only 5.4%. At the survey form, we asked the respondent if they know what is mental health, and gladly, majority know and only 3.7% didn't know. This showed that from 109 respondents, only few still doesn't have a clue about mental health.
75.2% of the respondents are aware about the increment of mental health issues, while 13.8% of the respondents are not aware, left the rest unsure. This shows that the majority of Malaysians are aware of the increment of mental health issues, but there are still some people are unsure about the current situation. The most voted are for teenagers with 28.4%, followed with a woman with 21.1%, and the least one is child with 9.2%. In total of 91.8% of the respondents are very satisfied with how Malaysians handling mental health issues during the outbreak, and the rest are not satisfied.
Do you think mental health care is important during the outbreak of the COVID-19 pandemic? Based on the response we collected from the survey, as many as 107 respondents answered yes, 98.2%, while the rest, 2 respondents answered no, 0.8%. So, we can conclude that most of them realize that mental health care is important during this quarantine. In the survey, the respondents were asked if they agree if the self-isolation for a long period can affect mental health. Most of them agreed. There is 66 respondents, 60.6%, and the second highest is strongly agreed, with a percentage of 27.5%, which is 30 respondents. The other were choosing the disagree, no respondent, and strongly disagree, 4 respondents, with both total percentage of 11.9%. The majority reason for the answer in question 6 is social needs. They agreed that the more they do not socialize with others, the more the mental health will be affected. Others were stressed because they do not go to work, and others were happy to be at home for a long period of time. So basically, these answers are based on their own opinion. It may vary for each person.
Question number 7 is asking about the acknowledgement of the online platform or hotlines for mental health issue during the outbreak of COVID-19. From all the responses, 65 of them acknowledged the online platform, while the other 44 claims that they didn't know the existence of it. Question number 8 is asking the respondent either they ever used the Italian case that provided by the government or not. 80 out of all responses will never use the Italian case, while only 21% have ever used it. This shows that the rate of mental health issues among the Malaysia citizens was small. Lastly, question number 9 is asking about the opinion that should have been taken to handle the mental health issues during the outbreak. Most of them suggesting on giving advices and moral support to people who in need by talking to them personally and giving virtual advice through social media. They also suggest on providing more platform and advertisement about the mental health issues to increase the awareness among the communities during the outbreak. Besides, the respondent also state that strengthening our religious belief can reduce the mental health issue among the Malaysian. Next, being productive, such as finding new hobbies or doing activities that we like, also can reduce the mental health issues. And lastly, keep a healthy life, such as taking healthy food and exercise daily to maintain our mental health condition, as it affects on how we act, think, and feel.
Based on the survey, we can conclude that all the null hypotheses were accepted. This proves that Malaysia doing a good job in handling mental health issues during this pandemic of COVID-19.